I'm back again with a topic that talks about why 90% of resolutions fail. Hello, my name is Dr. Prakash Chougule. I'm a cancer specialist. By no means I'm a health expert or a nutritionist, but in my field of cancer, so many of these cancers are either stimulated or are predisposing factors because of other associated conditions such as overweight, obesity, diabetes, heart disease. And when they do get treatment, how their treatment is often compromised and the outcome is compromised. I hope that you have had a chance to look at that video. And if you have not, I would suggest you listen to that video and then come into this video to see why 80% of them or 90% of them fail. So let's talk about the big picture about the fact that only 8% of people who take resolutions are able to carry it throughout 1 year. And you must have guessed, they are the ones who are rather disciplined and they do have previously established kind of consistency and commitment that the newcomers lack. So one of the reasons they fail is because they think too big, unrealistic goals. I'll give an example. For example, you get up in the morning, January 1st, after whether you partied or whether you drank or whatever, and splurged, doesn't matter. You wake up in the morning and say, this year I'm going to run a marathon. Well, first of all, you ask yourself a question, are you a runner? If you're not, is that a realistic expectation? A marathon is 26.2 miles. Most distance runners take about 9 months to prepare for a marathon. And one reason why they go in an incremental way, they do 5Ks, they do 8Ks, 10Ks, and eventually 5 miles or maybe half a marathon, and then they move on to the full marathon. So setting up a realistic goal is very important. And let's not even go to the extreme of marathons. Let's talk about somebody who has been sedentary, hardly ever does any exercise. To say that my neighbor walks 5 kilometers or 3 miles every day, I'm going to follow her or him. Well, are you used to that? Is it better to just do 15 to 20 minutes of regular walking and then go in an incremental way to your goal and then go to brisk walking, whatever? So that is what I'm talking about, thinking too big.